Friends, I am Arun Kakar. Today we are going to discuss something which is pretty common. At least once a week or once in fortnight, you see a patient with a goiter. Often more commonly seen in internal medicine than in surgery. Most of these patients are hypothyroid and they go to medical OPD. But in surgery is not rare. It's important to know how to arrive at a diagnosis in any patient with a goiter. And one of the prerequisites for arriving at a diagnosis is taking a proper, relevant history and doing a thorough examination. As a postgraduate, I know your primary aim is to pass a postgrad examination, but one should not forget the long-term aim is how to manage these patients with goiter. How to observe them, what basic parameters to be evaluated while doing a physical examination, which have a bearing on the further management, and as a part of evaluation, you develop a rapport, you develop a bond with the patient and can get a lot into the insight of what has been going around. Just doing a surgery or prescribing a medicine is not the end and be all. Communicating with the patient, talking with the patient, or making patient come out on his or on her own is very, very important. And in this context, today we are going to discuss about the clinical evaluation, emphasizing more on physical examination and eliciting the findings in the next half an hour or 40 minutes.